opinions expressed on this program are those of the participants and do not reflect the views of BronxNet or the program underwriters.
BronxNet. Your voice, your views, your vision.
Vice President of Planning, Marketing, and Public Relations, your co-host for tonight's HealthBeat television program. We welcome you, our many viewers, to HealthBeat, and we encourage you to continue participating in the program by calling 718-960-7241 with any healthcare questions you may have. That's 718-960-7241. As always, we promise to do our very best to keep you medically informed and healthy by discussing the topics that are of interest to you, our Bronx community. Please tune in every Monday evening from 6:30 to 7 p.m. on Channel 67, and you can also find out more information about Bronx, Lebanon, and its many community services online at our website, bronxcare.org. Tonight, my co-host, Dr. Milton Gums, Bronx, Lebanon's Vice President and Medical Director, and I will be focusing on diabetes, both in terms of detecting it as well as controlling it.
Yes, Errol, diabetes is a continuing concern in our Bronx community with extremely high incidence of occurrence. Joining us this evening to help diabetes patients and their families better understand how to control this often serious problem are Diana Malkin Washheim, Director, Nutritional Services and Diabetes Coordinator at Bronx Lebanon Hospital Center, and Sandra Stein, Educator Coordinator at the Bronx Lebanon Hospital Center. Later in the show, we will be talking to some patients, and we have here Shoba Nanivanda, yes, who is a coordinator at the hospital also, diabetes.
All right. Now, before we hear from you, our panelists, let me once again encourage you, our viewers, to call in with any questions or comments you may have. The number to call is 718-960-7241. That's 718-960-7241. And please call us. Now, Ms. Washheim, let me start the program by asking you to define for our viewers or describe what is a diabetes educator? What are the things you do in a given day?
Yeah, that's an excellent question. A certified diabetes educator is actually a specialized area that somebody needs to either be, you could be a physician, you could be a dietitian, you could be a nurse, a social worker, or a pharmacist. You need to be 2 years within the discipline. You take a rigorous exam, and then you can become a certified diabetes educator specializing in the physiology of this, in diabetes and how to manage somebody who has diabetes, their specific lifestyle, their medication that they're on. You're helping them figure out what does that medication do, their nutrition, activity, and to also be the go-between the patient and the physician. So you're actually helping the physician manage their patients with diabetes.
Okay.
Yes.
Well, let me ask you a simple question.
Yes.
How often do your roles overlap? All the time, it seems.
You know,
what's the difference? What do you do differently a little bit?
Between the primary, oh, you mean us, us three?
Yes.
Well, we're in 3 different clinics.
Oh, that makes it simple.
Yes, we're in 3 different clinics. So Sandra is in 3rd Avenue, Shober's at Poe, and also does 1 day at ACN. Also, Shober does the majority of adults and peds. I'll do 1 day peds. Sandra, you're doing a lot of adults? Mostly
yes.
adults.
Yeah.
But we're in 3 different clinics working with 3 different sets of physicians.
So the message is the same?
It's exactly the same.
And what is that message that we're trying to get out to
and
the
it's really
community?
funny, this is going to sound funny. and you can also add to that. But the way I wanted to set up the program, that no matter where that patient goes, no matter what clinic, that it's going to be the same, just like McDonald's.
Yes.
Okay, I don't want to use McDonald's, but it's very true. No matter where you go in the country, the quality of care, I mean the quality or the taste of the food is the same. It's the same thing with our diabetes program. So if a patient, let's say I'm not there, but we'll see Shoba or Sandra, it'll be the exact same quality of care.
Right. Now, Ms. Stein, in terms of your role, how would you define the importance of education?
I think it can make a really big impact on how people manage their disease. Diabetes is a very manageable disease if you give people the right tools to work with. In terms of understanding their medications, understanding what lifestyle changes they can make to really improve their care, and also just getting them to exercise, all different type of lifestyle modifications that can really impact their disease.
Okay.
Okay, Ms. Warsheim, just what is diabetes from a clinic perspective? What do you talk to the patients about?
You know, depending on if a patient comes in initially or a follow-up, but let's say a person has never seen, somebody who comes in brand new.
Yeah.
The assessment, it can be quite lengthy. It can be anywhere from 30 minutes to 45 minutes. So there isn't a specific allotted time. So I need to know where that patient is, who is sitting in front of me, and also their family history. And then I do a 24-hour recall, which is what have they been eating or what is their usual food intake in the last 24 hours. I need to also know their activity. What is their lifestyle? You know, is transportation an issue? Is food an issue? Availability of food is an issue, and that also impacts. Also, I need to know, you know, when was the last time they went to see the dentist, their foot doctor or their eye doctor and things of that nature. I need to know how long they've had diabetes and what they've been doing and their medication. So this is a tremendous amount of information that we're having this dialogue.
You also gauge the type of cooperation you're going to get from the patient. On that visit,
and you know,
because it's important, is it?
Absolutely, and you know what's really great? They want to be there. They want to have the help. They haven't been feeling good for so many years, so they do come in, and it's a really nice dialogue.
Right. Now let me ask you, Ms. Nandiv, is there a cure for diabetes, or will there ever be one?
Right now, there isn't one. But we're hoping, a lot of research is going on, that someday we'll find some cure for diabetes, but definitely it can be controlled.
And what about the difference between type 1 and type 2? We
Type
hear that
1,
all the time.
Type 1 is basically, right from day one, they need insulin to survive. And then type 2 is when they're diagnosed, initially they may go on insulin, but not everybody goes on insulin. They're usually managed by medications. And, you know, we when they come to see us, we give them a meter to check the sugars to see if they're in control or not.
Right.
And we may start them off on insulin, but then their insulin is tapered off, and then they can just go on pill if they're able to lose weight, if they change their lifestyle and they eat well, then they're very well controlled just on medication. Some people may not be on medication. They can come up even on the medications.
Right.
I may add to that, and that's a really good point that Shoba has made, that we're encouraging all the physicians, especially the primary care physicians, to refer their patients who are not yet diagnosed with diabetes, who have pre-diabetes. And we are picking that up through labs, through their blood test. And so now we can offset the diagnosis. Again, it's a lot of work every day. You know, they have to possibly integrate specific things.
Well,
Prevention.
everyone wants to know, what do diabetics eat? Tell us about the diets. What's restricted, what's not restricted?
Well,
and if not, why not?
Well, as Diana said earlier, we get a big picture of the person's lifestyle.
Right.
And everyone's diet's different culturally and also how they grew up. And so you individualize your care for the patient. There's not one size fits all. So one person might eat rice and beans, and it's okay for them to eat rice and beans, but not more than a cupful. They shouldn't eat a whole plate of rice and beans.
Right.
Another population might eat pasta or potatoes, but you know, if you buy a potato, don't buy it when.
So what you're trying to tell the diabetic is that you can eat whatever you have been eating before, because a lot of people are afraid of the diets.
Right. There's really no foods you can't eat. It's how you eat them and how you incorporate them into your whole diet.
Okay.
Well,
You don't agree?
I do agree. You know, there is a but. One of the things that I really encourage and emphasize and highly suggest with everybody is really to get off the sweetened beverages.
Yeah.
You know, I have to say.
That's for everybody. Almost.
That's for
It
everybody.
is for everybody,
Yeah.
but it's really interesting because I think there may be a little disconnect between people who have diabetes, even pre-diabetes, that if they drink juice or soda, that it doesn't affect their blood sugars, and it does.
Yeah.
So we really, I think we hone in on that.
Well, absolutely. I mean,
Yeah.
people think just because a soda is light colored, it's okay. They won't drink the color, but they'll drink a gallon of ginger ale.
Or Sprite.
Or Sprite, yes.
Sprite.
Or what? But so you do educate them on that too. I definitely agree with that. But in terms of food, you just work with where they're at.
Right.
Now, expanding on Dr. Gums' question, what are the other factors that are important in controlling diabetes?
Checking your blood sugar, making sure that your blood sugar is in control, coming to your physician appointments. That's really
Is
important.
that really a problem?
Sometimes it
There's
can,
a lot of no-shows.
There's a lot of
Transportation's an issue. There is a lot of barriers.
There's a lot of barriers.
Yeah.
And cultural barriers, because people often will not take the medications like they're supposed to, and they'll tell their physician that they take it. And
Really?
and I had a patient say to me, "Oh, I lie to the doctor all the time. Doesn't everyone?" I'm
I
like,
do that all the time myself.
you know, and the issue is, so if someone's being bumped up on insulin and they're not taking it, it could be really dangerous once they take it. So honesty with their physician, working with their physician. The physician's not the enemy. The real problem is managing the disease and really getting everything under control.
I will say that, and I think you two will agree, that I think patients will say to us, and it may be a time factor, they will tell us things that they're not telling the physician. And then this is where the team approach comes in. And now we're communicating with the physician, so it's really a partnership that we have at the hospital. And I think our program is really doing a great job in doing that. There's a lot of communication that goes on.
Right.
We do have a diabetes case management meeting, you know, the first Thursday of every month. So I
We
think
also spend a lot of time with the patient.
Right.
And, you know, we ask them, are there any emotional concerns, financial concerns? Are you not able to shop? You know, do you get support from the family and from the community?
Let me ask you a question.
Addressing the barriers.
Let's assume you all started off with 300 patients. After 6 months, how many of those 300 are still patients? Just, you know, just the number is unimportant. I'm talking about
we're talking about people who have the diagnosis of diabetes.
And come
who
back.
have been coming to you.
Right.
Do they come in 6 months? Do they continue to come?
Yes.
What percentage?
I would say, I mean, follow-up can be an issue, but I would have to say 75%.
Yeah.
Yeah.
I wouldn't say 100%, but I'd say 75. Again, there are certain barriers that we have no control over.
But you believe you are succeeding in getting the word out and actually helping the patient and their families that are out there.
You know, the hospital does a great job in communicating with our patients in terms of follow-up, but I think word of mouth is huge.
Yeah.
Okay.
Especially
On
in
that
community.
note, let's pause for a short break.
Sure.
And when we return, we will continue our discussion as well as take calls from your viewers. Once again, the number to call is 718-960-7241. That's 718-960-7241. And please call us.
During this, our year of orthopedics, we recognize the extraordinary accomplishments of the orthopedic team. We also take pride in our new ambulatory care facility, which will include an entire floor dedicated to orthopedic services.
We have established a world-class orthopedic program here at Bronx, Lebanon. Our dedicated surgeons and professional staff offer exceptional services for hip, knee, and shoulder replacements, spine, hand, and foot surgery, trauma care, and sports medicine.
Crucial to orthopedic surgery in the operative process are the anesthesiologists.
The orthopedic surgeons depend on the anesthesiologist to keep their patients safe during the surgery. But most importantly, they rely on us to keep their patients pain-free.
And nurses at Bronx, Lebanon are taking on pivotal roles as key members of the OR team.
Our highly trained staff provides essential assistance to the orthopedic surgeons, as well as specialized care and attention to patients prior to and following their operation.
Surgery can be stressful for elderly patients or those with serious medical problems. These high-risk patients often require follow-up post-operative care in the ICU.
Our critical care physicians, in collaboration with the orthopedic team, are addressing the serious medical problems and the complications that occur following surgery.
In the Women's Health Center, screenings are performed to detect bone problems related to genetic factors and the aging process.
Our GYN team cares for women with osteoporosis for its prevention and treatment.
Many of Bronx Lebanon's orthopedic patients first come through its emergency room.
Our staff works closely with the orthopedic team to respond immediately to injuries resulting from falls, sports injuries, automobile and bicycle accidents, and other forms of trauma to the extremities and spine.
And Bronx Lebanon is also leading the way in internal medicine, ear, nose, and throat, surgery, neonatology, ophthalmology, family medicine, pediatrics, radiology, psychiatry, dentistry, pathology, and long-term care. Its Bronx Care Network is fulfilling the hospital's essential role as doctor to the community.
Welcome back to HealthBeat. We come to you live on BronxNet every Monday evening from 6:30 to 7 p.m. Please call us at 718-960-7241 with any questions you may have, and we will certainly do our best to answer them. That's 718-960-7241. And let's continue our discussion. We now welcome two of our patient success stories at Bronx Lebanon. Ms. Clark.
Patients, we don't know if they're successes.
Ms. Carolyn Miller and Mr. Orville Clark. And both of these patients are going to share with you, our viewers, their experiences at Bronx Lebanon. Now let me start with you, Ms. Miller. What brought you to Bronx Lebanon? And what has happened since you've been at Bronx Lebanon?
Well, what happened with me at Bronx Lebanon Hospital? Well, the staff have been really good, have really given me really good care because it started off on a journey that I didn't have health insurance.
Right.
And they put me on their charity care plan. And I was put in the right direction to work with Dr. Shoba and different doctors in the Bronx Lebanon Hospital. And they helped me to get my blood sugar lower because it was up to 11.
Wow. And you'll explain that to us later on in the show. And you, Mr. Clark?
Well, when I found out I had diabetes, it was $3.99. I went to Mrs. Ann here, and she gave me medication, and what I take for myself, I get the ginger, cinnamon, the ginger, cinnamon, I pound them, I boil them.
That's an island cure, right?
Yes.
Okay, just checking.
I put it in the fridge and I drink it. My daily meal in the morning, I have oatmeal. Sometimes I have toast with egg white, lettuce and tomato. And afternoon, I have okra, lettuce, tomato, and my regular food.
So your diabetes is under control now?
Thanks to Miss Ann here.
Aren't you sure it's not the okra?
No.
The
you could look at that, you will see that.
Okay. Ms. Diane,
Yes.
How closely do certified diabetic educators such as yourself work with the doctors and most of the doctors? And you get along with those
I get along with everybody,
surgeons,
yes.
difficult primary care people and so forth?
No, nobody's very challenging at all. I don't
want everybody to get the feeling that it's a cakewalk.
Oh, you mean in terms of the journey of going through diabetes?
Yes.
You know, I think a lot of our patients have come from a place and we just move forward. And yeah, I think it's very difficult because once they leave my office, they're motivated, but they're going back to where they came from. So they have to come. They should be going to a CDE, a Certified Diabetes Educator, every 2 to 3 months.
Really? Yeah.
Yes.
And these patients have come?
Absolutely.
Yeah. And do you recommend it to your
Mr.
friends?
Clark, yes, fall off.
Huh?
Mr. Clark sometimes, he comes on a regular basis.
Yeah,
yes,
really? Yeah.
yes. And I think the people who do come on a regular basis, we do see more of the successes. People who don't come after a year, in the beginning they'll be in control and then they're out of control. So they do have to come to be reminded of what they need to do.
Ms.
Yes.
Clark, you said that your hemoglobin
A1C
was 11 when you started?
11.
That's a little high.
That was very high.
Very high.
Very high. And they worked with me and put me on the right track with my food portions and medicine. and now 7.
Just
Yeah,
let me ask you a
7%.
question. This is not a fair question, but what were you doing wrong before? You know, do you remember?
Yes, I was
Okay.
drinking a lot of sodas.
Mm.
A lot of
Really?
sodas.
A lot of
A
soda.
lot of sugar intake.
Really?
And how about you, Mr. Clark? What were you doing wrong?
I used to do construction. So working hard, I will get 2 liter ginger ale, put them in the freezer,
and drink all
and
day.
then drink them before I go sleep.
Yeah.
Right.
And all the time we building up and I don't know.
Hmm.
So I find myself peeing. So I said, let me see a doctor. I went to Miss Ann here, and she fixed me up.
That's really good to hear. Now, expanding on what Dr. Gums had asked you, what do you see as the advancements now occurring for patients such as Mr. Clark?
You know, with the epidemic of type 2 diabetes, the technology definitely has changed. Medications have
Right.
changed. But what hasn't changed is lifestyle modification. Exercise and eating good, healthy food. That hasn't changed. That's always the foundation of moving our bodies from not being healthy to being healthy. But there's so much more medication that we can play around with. So if something is not working for 3 months, we can try something else. In insulin, although it actually works, we know insulin works, it may not be the gold standard anymore.
Okay.
Mhm.
Mr. Clark, tell us how your quality of life, your lifestyle has changed since you met this devilish woman here.
Well, she tell me I have to take some exercise and different thing, and I do as she say, and I see a lot of progress in my diabetes.
Yeah. How much exercise? I mean, just
Well,
limit
I
it.
walk a couple blocks at a time.
Yeah. But you make a definite effort to
Yes,
do
yes,
that.
yes.
Yeah.
And how about
I take daily walks. That's what help motivates me, and exercise, dancing with the gospel music.
Really? Oh,
Right.
really? At home or you go
At home.
to? Oh, really?
I go to
Yeah.
church too. Yes.
Yeah.
I mean, I want to say I don't think people have to change that much.
Yeah.
Walking, dancing, and doing something you enjoy. I would never say go join a gym. 1, it's expensive, and 2, you join, you go once, and then what happens? Or get a treadmill. Forget it. You put your clothes on it. So just do what you enjoy.
Stop talking about me.
Just do what you enjoy, and I think it all falls into place.
Right. Now, how do you account for diabetes being so high in the Bronx, the incidence of diabetes?
That's a great question. I think that now people are getting screened. I think that once somebody is diagnosed, they've had the symptoms for the last 5 to 7 years.
Yeah.
And I think during that time, people are not seeing their physician. So I think people are seeing their physicians or talking about it. And I think, again, word of mouth, people who are getting their care, they're feeling better, they're telling other people about it, and they are coming.
Okay. Ms. Miller, some words of encouragement to your friends who are out there not coming to Diana?
Well, to better control your blood sugar, you should always follow your doctor's instructions. You know, when they put you on insulin, make sure you count, do the hours. Follow those hours. Like sometimes when you take a shot, it could be like 4 hours apart as you should take those shots. That's what helped me.
Mm-hmm.
And then, instead of all the sugary drinks, drink more water. A diet soda maybe.
Yeah. So you're on insulin?
I'm on insulin.
Yeah.
Yes.
And you, Mr. Clark?
No insulin.
You're just on pills?
Yes.
Yeah.
And that ginger.
Huh? Ginger.
And okra.
And okra.
Yeah.
And okra too.
So tell us about your eating habit. Just tell us. I mean, you said it already, but I would like you to repeat it for.
I eat anything also fried food. No fried food.
Yeah.
No soda.
Yes.
Just water and my regular food.
Right.
Do you have any do you cheat ice cream every now and then?
No ice cream.
Yeah. Cake?
No.
Not even for your birthday?
No.
And you exercise every day?
I walk around.
Right. Now I wanted to ask Ms. Malcolm,
Yes.
what makes the diabetes program at Bronx Lebanon, in your opinion, so unique?
I think that we have a lot of supportive physicians who refer their patients and realize that they can't do it alone without certified diabetes educators, and they, because we have a lot of people coming into the hospital, and I think we all communicate, and I think we have a lot of good people in the program, and we're doing a lot of groups, and I think group education helps people individually. They get to connect with everybody, and I think people feel good about coming to the hospital.
Right. Now, how do people in our community get in touch with you or gain access to the services?
Well, one, they have to become a patient in order to access the CDE, so they would call the call center, make an appointment, general ACN clinic or any of the clinics, whatever is convenient for them, and they first will see their primary, and then they get referred to one of us.
Yeah. But are you all close in any way? Your operation and
Yes.
the primary care team, are they adjacent in buildings?
Yes, we're all very close.
Oh, really? That's
Yes.
good, because that makes a difference.
Yep, it's a knock on the door, or everyone's a phone call away.
Yeah.
Right.
So when I call, they actually answer the phone.
Right. Now, we haven't touched on it, and in the time remaining, maybe you could just briefly talk about the juvenile diabetes issue
Type
for
1
the
diabetes.
for the youngsters that are out
Thank
there.
you. Thank you for bringing that up. The pediatric kids who have type 1 diabetes,
Right.
the majority of them are seen at the Poe Clinic, which is over at 2432
Near
Grand
Fordham Road.
Concourse,
Yeah,
right
yeah,
over
yeah.
there. And Dr. St. Louis is our pediatric endocrinologist. She's great. I'm there
She has been
Tuesday.
on the
Shoba's
show,
there,
yeah.
yep. And she also has the Sugar Babies, which is a diabetes support group.
Right.
We're also putting a lot of our kids and adults on insulin pump therapy. And yes, I think that in itself, the kids and the adolescents, that's a definitely different population.
Right. Now, just for people in our community, how do they determine if they have diabetes? They have to come in. Is there any self-test that's out there that they can check, or you recommend that they just come and see their physician?
They come in and they would be,
No,
they
but
could
what
be
are
checked.
some hints?
Warning signs.
Well,
warning signs?
type 1 is different than type 2.
Yeah.
So if we're talking about type 1, they're presented very different. It's very
Well,
apparent.
let's start with
There's-
the adult aspect.
Okay, for
about 40 seconds.
For the adults, I mean, there could be weight loss, there could be thirst, and they may be saying, I'm not doing anything, I'm losing weight. That
Right.
really is a clear sign they need to see their doctor.
And on that
Yes.
note, let me thank each of you for joining with us on tonight's HealthBeat television program.
Okay.
And most importantly, let me thank you, our viewers, for tuning in this evening.
In the interim, if you, our viewers, have a question or need assistance, I encourage you to call our Physician Referral Center service by dialing 718-99 That is 718-992-7669. Or you can refer to our website at bronxcare.org. Good night, and we'll see you next week. Right.
Now the big guy comes up to bat, hitting .342 with 92 RBIs and 36 homers.
Chill raw and prepared foods promptly. 1 in 6 Americans will get sick from food poisoning this year. Keep your family safer. Check your steps at foodsafety.gov.
This is one amazing truffula tree. Can you imagine a place where these grow everywhere? Yes, it's called the forest, a magical place to enjoy with your family. So discover the forest and explore all the wonders